everyone. We've got some sample specimens here. It's actually really interesting to see the comparison between certain cases. And basically what they are bladder stones. So what we do is we usually send bladder stones away to a laboratory once they are removed from a patient. The lab will tell us exactly what that stone is made up of, so that we can determine what we need to place the patient on to try and avoid those stones from reoccurring. So if you want to have a little look here, what's so interesting is these variations. So we've got a little stone in this case. You can see it's kind of the size of a thumbnail, sort of very smooth and rounded, like a little pebble. And then we have this ginormous stone. So this, well, I mean, the dog that had this would have been in a lot of discomfort. You can imagine a bladder isn't actually very big, and this was basically taking up the entire bladder's circumference. And just to give you an idea of size, we've kind of got it against there. So, so this was removed, and you can see that this one is actually really kind of knobbly and far less regular than this one. So yeah, a lot of variations in these cases, and what is interesting is the lab will ask us kind of what the patient's eating, because certain things play a role with the different variations. So you get struvite stones, and you get calcium oxalate stones, for example, and different pHs of the urine can create different stones. Often in these cases there is also a bacterial cystitis, so a bacteria that's causing an infection that then causes these little calcium accumulations that then result in these little stones. So yeah, and often signs in a dog may be urinating a little bit of blood. Cats also can get them, but we don't see them as well, when they urinate blood, it can be other causes as well, but often the most common thing is urinating blood and straining a lot, and often we have to remove them, and then they're a lot more comfortable. So we'll send these off and we'll see what we get, and then hopefully we can put these patients on the right foods to help them avoid these from reoccurring.